Good morning everyone. Welcome to the channel. Today we are going to conduct a session on antiviral drugs. Broadly, antiviral agents are studied as non-retroviral drugs and retroviral drugs. From that, today we are going to cover non-retroviral drugs, in which we will discuss anti-herpes virus drugs and anti-influenza virus drugs. So now let's start the video with some introduction. Viruses are the ultimate expression of obligate intracellular parasitism. They not only take nutrition from the host cell but also direct its metabolic machinery to synthesize new virus particles. Viral chemotherapy, therefore, was considered impossible as it would require interference with cellular metabolism in the host. However, in the past 50 years, virus-directed enzymes have been identified in the infected cell, and some viruses have few enzymes of their own which may have higher affinities for some antimetabolites or inhibitors than the regular cellular enzymes. In addition, drugs have been developed which target virus-specific steps like cell penetration, uncoating, reverse transcription, virus assembly, or maturation and release from host cell, etc. Another stumbling block is that in majority of acute infection, viral replication is already at its peak when the symptoms appear. To be effective, therefore, therapy has to be started in the incubation period, that is, has to be prophylactic or preemptive. So now let's quickly see the classification of antiviral drugs, which will include anti-herpes virus drugs, anti-influenza virus drugs, anti-hepatitis virus drugs. Today we will going to discuss about anti-herpes virus drugs and anti-influenza virus drugs. The anti-herpes virus drugs include edoxuridine, trifluridine, acyclovir, valacyclovir, famciclovir, ganciclovir, valganciclovir, cidofovir, Foscarnet. The anti-influenza virus drugs include amantadine, rimantadine, oseltamivir, zanamivir, and piramivir. Okay, now so let's start the discussion about anti-herpes virus drugs. These are the drugs active against the herpes group of DNA virus, which include herpes simplex virus 1, herpes simplex virus 2, Varicella zoster virus (VZV), Epstein-Barr virus, and cytomegalovirus (CMV). The various conditions due to these infections are also stated. The herpes simplex virus 1 causes herpes labialis, herpes esophagitis, and herpetic encephalitis. The herpes simplex virus 2 causes genital herpes. The VZV causes chickenpox, herpes zoster. Epstein-Barr virus causes infectious mononucleosis. The cytomegalovirus causes pneumonia, rhinitis, encephalitis, and gastroenteritis. Okay, so now let's discuss a very important antiviral agent, acyclovir. It is a synthetic purine nucleoside analog that has anti-herpes activity. It is more effective against herpes simplex virus 1 and herpes simplex virus 2 than Varicella zoster virus infections. The mechanism of action of acyclovir is that it inhibits herpes virus DNA polymerase competitively, and it gets incorporated into the viral DNA and stop lengthening of DNA strand. The terminated DNA inhibits DNA polymerase irreversibly. This deoxyguanosine analog requires a viral specific enzyme for conversion to the active metabolite that inhibits DNA synthesis and viral replication. Acyclovir is preferentially taken up by the virus infected cells. Because of selective generation of the active inhibitor in the virus infected cells and its greater inhibitory effect on the viral DNA synthesis, acyclovir has low toxicity for host cells. A several hundredfold chemotherapeutic index has been noted. Acyclovir is active only against herpes groups of viruses. Herpes simplex virus 1 is more sensitive, followed by herpes simplex virus 2, while cytomegalovirus is practically not affected. Herpes simplex virus and Varicella zoster virus have been found to develop resistance to acyclovir during therapy. The former primarily due to mutants deficient in thymidine kinase activity, and the latter primarily by change in specificity of virus-directed enzyme so that its affinity for acyclovir is decreased. Okay, now let's discuss the pharmacokinetics of acyclovir. Only about 20% of the oral dose of acyclovir is absorbed. It is little plasma protein bound and is widely distributed, attaining cerebrospinal fluid concentration that is 50% of the plasma concentration. After topical administration, systemic absorption is negligible, but it penetrates cornea well. Acyclovir is primarily excreted unchanged in urine by both glomerular filtration and tubular secretion. Plasma half-life is 2 to 3 hours. Renal impairment necessitates dose reduction. It is highly potent anti-herpes agent. It has high therapeutic index with low toxicity to host cells. Therapeutic uses of acyclovir. Acyclovir is used in genital herpes for oral, intravenous and topical administration. It is used for primarily and recurrent infections. High dose of acyclovir are needed for recurrent infections. It reduces the frequency and severity of herpetic lesions. Acyclovir is used in herpetic encephalitis. Intravenous acyclovir is the drug of choice for encephalitis caused by herpes simplex virus. Herpes simplex keratitis. Acyclovir is used topically in herpetic keratoconjunctivitis. In mucocutaneous herpes simplex virus, acyclovir is used orally or topically in the treatment of stomatitis, herpes labialis, and ulcers in mouth. It is used intravenously in immunocompromised patients. Herpetic whitlow, nail bed infection. Oral acyclovir is used for the prevention and treatment of whitlow. In chickenpox, acyclovir reduces the duration of illness if started early in patients at risk of severe illness and immunocompromised individuals. In herpes zoster, acyclovir and valacyclovir are effective. Acyclovir is given orally, topically and IV, and valacyclovir is given orally. Adverse effects of acyclovir. Acyclovir is usually well tolerated. Nausea, vomiting, diarrhea and headache are the other side effects. High doses may cause neurotoxicity with tremor, confusion, disorientation and convulsions. On topical use, it can cause irritation and burning. Here in this flowchart, we can see acyclovir, valacyclovir, famciclovir and peniciclovir inhibit DNA synthesis of herpes simplex 1, herpes simplex 2, varicella zoster virus and hepatitis B virus. Valacyclovir is a prodrug for acyclovir which undergoes intracellular activation to acyclovir triphosphate and then inhibits DNA synthesis. Whereas famciclovir is a prodrug for peniciclovir which undergoes intracellular activation to penciclovir triphosphate and inhibit DNA synthesis. Edoxuridine is also an antiviral antiherpetic agent. It is a thymidine analog that acts against DNA viruses. It inhibits viral replication. Edoxuridine is used topically for herpes simplex virus, keratoconjunctivitis. The adverse effects are local irritation, itching, pain and swelling of lids. Valganciclovir is a prodrug of ganciclovir. It has better bioavailability than ganciclovir. Now let's have some look on the important features of some antiherpetic agents in the given table. Valacyclovir, famciclovir and cidofovir are the prodrugs while ganciclovir and Foscarnet are the active drugs. Route of administration for valacyclovir is oral, better oral bioavailability than acyclovir. Famciclovir, oral, well absorbed from the GI tract. Ganciclovir, intravenous and oral. Foscarnet, intravenous and cidofovir, intravenous. Valacyclovir and famciclovir are used in genital herpes, orolabial herpes and herpes zoster. Ganciclovir is used in the prophylaxis and treatment of severe cytomegalovirus infections, that is rhinitis, pneumonia, gastroenteritis, etc. in immunocompromised patients. Foscarnet is used in acyclovir-resistant herpes simplex virus and VZV infections. Cidofovir is used in cytomegalovirus rhinitis. Adverse effects of valacyclovir are nausea, vomiting, skin rashes, and CNS symptoms in high doses. Famciclovir adverse effects are nausea, vomiting, diarrhea, and headache. Ganciclovir causes bone marrow suppression, nausea, vomiting, headache, hallucination, convulsions, mutagenic, carcinogenic, and embryogenic effects. Foscarnet causes nephrotoxicity, convulsions, headache, hallucinations, and anemia. Cidofovir causes nausea, vomiting, hypersensitivity, nephrotoxicity, mutagenic, and embryogenic effects. Now let's discuss anti-influenza viral drugs, which include amantadine, rimantadine, oseltamivir, zanamivir, and pevamivir. Amantadine. It is an antiviral drug that has anti-Parkinsonian effect as well. It inhibits the uncoating and assembly of influenza A virus, thus prevents viral replication. It is administered orally, well absorbed from the GI tract and excreted unchanged in urine. Uses. Amantadine is used for the prophylaxis and treatment of influenza A virus infection. Second, for Parkinsonism. ADRs. They include anorexia, nausea, epigastric discomfort, headache, insomnia, confusion, hallucination, and hypotension. It is contraindicated in pregnancy because of teratogenic effect. Rimantadine. Its mechanism of action is similar to that of amantadine, but has a longer duration of action. It is administered orally, well absorbed through the GI tract, and intensively metabolized and excreted in urine. Oseltamivir. It selectively inhibits influenza A and B virus neuraminidase, thus interfering with the release of virus from infected cells. It is used orally in the treatment and prevention of influenza A, avian influenza or bird flu and swine flu, and influenza B viral infections. Adverse effects are nausea, vomiting, abdominal discomfort. Dose. For prophylaxis 75 mg once a day for 7 days, and for treatment 75 mg twice a day for 5 days. Zanamivir. The mechanism of action and uses are similar to those of oseltamivir. Oral bioavailability is low. It is administered by inhalation. Adverse effects are bronchospasm, headache, and dizziness. It should be avoided in patients with airway disease. Peramivir. It is active against influenza A and B, bird flu, and swine flu viruses. It is administered as single IV dose in severe influenza. It is well tolerated. Okay, so that was the end of the session. We will continue the topic in the upcoming videos, that is antiretroviral agents and the anti-hepatic antiviral agents. Thank you for watching the video. Share the video with your friends to spread knowledge. Thank you.